let me tell you one of the best tips I could have ever given you is the choice of implant. Wherever there is good bone volume in terms of height and width, you can use the compressive or the KOS implant, just like how you would have done in your conventional implant practice. For doctors who don't know how to place it, don't worry, I will show you how to place the compressive implant. But the game changer is knowing how to put the BCS implants, and all cases can be done with BCS implant. If you want to stop worrying about whether you have bone, don't have bone, just go for BCS implant. Now, which BCS implant to go for? For all practical purposes, the diameter of choice is 3.5. The diameter of choice is 3.5. How the length is there is very simple. You have to remember 8, 10, 12, 14. This is a 2 to 2 millimeters. So 8, 10, 12, 14. And after that, 3 millimeters. So 17, 20, 23, 26, 29, 32. Again, I will repeat, all cases can be done with BCS implant. For all practical purposes, we use 3.5 diameter, and what the length we have to take is 6, 8, 10, 12, 14, 17, 20, 23, 26, 29, 32. If you have these implants, you can do any case with just these implants in your kitty. Is this clear to all? BCS 3.5, 6, 8, 10, 12, 14, 14, 17, 20, 23, 26, 29, 32. Perfect. The only area we use wide body implants, I already mentioned, is near the sinus. Any diameter above 4.5, 4.5, 5.5, 7, 9 are called as wide diameter implants. So I can have a 3.5 implant with a small head, and I can have a 3.5 implant with a large head. Don't get confused with the head. I am telling you regarding the apical threads. As you see on the brochure, I have told you the page number 19, BCS implant. I hope all of you are referring to it. Are all of you referring to page number 19? Please let me know. And you can see only the 3.5 implant is what is important for us. That's it. So how we do this? We have a maxilla. Okay. We have a maxilla. Give me the other one. Is there? I'll just take a bigger model so you people can understand it. Okay. So if this is my patient, I palpate inside the mouth, buccal and palatal. So I hold my fingers, buccal and palatal, like you can see here. Okay. Is it seen to all of you? See this. I will show again. Can you see now? Is nothing. All I need to do is just hold buccal and palatal. That's it, in the mouth. I take my first drill, which is 2 millimeters, in my straight hand piece, and I close my eyes because it's just not required to see what we are doing. You just have to feel. And I start drilling. When my drill perforates the first cortical, I get a resistance, almost like you're doing a root canal. You know, when you tip into the enamel, you have resistance. And then your burr starts sinking in. That's the cancellous bone. So I start drilling. It goes in the cancellous bone. My drill just starts slipping. And I get a point of resistance, which is my second cortical. That is where I note the length on the drill. Again, I will repeat. I check. I put my fingers. I start drilling. Okay. If I feel the vibration on my buccal finger, that means I'm going too buccally. If I feel it on the palatal, that means I'm going too palatal. Just try to remain in the center of the range